Hello and welcome to Clinical Exam Series with Dr. Piru. In this video, we are going to be discussing respiratory examinations. There are two aspects of this video. In the first part, we'll tell you what to do when carrying out respiratory examinations in the exam. The second aspect is going to demonstrate respiratory examination using 3 minutes as our time frame. Now, in the exams, you usually have 3 to 5 minutes to carry out your physical examinations. We'll use 3 minutes to be on the safe side. I should also let you know that there are some preliminary steps to take before you start your physical examinations. Now, these include you need to greet the patient, you need to establish some form of rapport and assure the patient you will not inflict pain. You also need to obtain an informed consent from your patient. It's important to screen your patient before you expose the patient. In respiratory examination, you position the patient in a supine position. Stand on the right hand side of the patient. If you are left-handed, however, inform the examiner before you stand on the left side of the patient. There are 7 core steps in respiratory examination that you should carry with you into the exam hall. The first step is inspection of the patient. This is where you are going to count your respiratory rate. I should tell you as a side note that counting of respiratory rate is going to take you a full minute. You cannot afford that in the exam. So looking at your watch and observing the patient's chest for a few seconds is going to pass for you counting the respiratory rate. While inspecting the patient also, you look for signs of respiratory distress such as flaring of the alar nasal, trachea tugging, signs of intercostal recession, and the use of accessory muscles to respirate, as well as grunting respiration. This is what you do when you are inspecting the patient. You also look for chest wall deformities, for example, scarification marks, pigeon chest, or a barrel chest. This will be shown in the picture test aspects of this course. When palpating, the first step is to check for tracheal centrality. Then we check for chest expansion. When we check for chest expansion, you also check for paradoxical respiration and flare chest. Using the ulnar border of your hand, you check for tactile fremitus, and you do this in all the lung zones anteriorly and all the lung zones posteriorly. You also check for vocal resonance on all the lung zones anteriorly as well as all the lung zones posteriorly. Tactile fremitus and vocal resonance is done by asking the patient to pronounce a syllable such as 99 while you use the ulnar border of your hand to palpate anteriorly as well as posteriorly. The next aspect is to percuss. We percuss on the intercostal spaces across the lung zones. We percuss all the lung zones anteriorly as well as the lung zones posteriorly. Percussion notes could be hyperresonant, resonance, which is normal, dull, or stony dull. The last step of every physical examination is to thank the patient as well as to cover the patient.